Hi, and welcome. The topic for today's lesson is physical activity motivation and how health professionals can motivate people to meet minimum physical activity recommendations. Let's start off with what physical motivation actually is. It can be explained as the motivation for exercise participation. Here's Judy, our case study. She has diabetes. Her doctor advised her to lose 5 kilograms. Judy is now motivated to exercise. Judy displays physical activity motivation. Moving on, psychological theory can help explain physical activity motivation through the self-determination theory. This theory explains three innate needs: relatedness, competence, and autonomy. The desire to meet these needs motivates participation in activities that will fulfill the need that is unmet. The self-determination theory introduces a continuum of motivation. First, external and introjective motivation. They're not recommended to be targeted by health professionals as both place significance on external reward systems. Moving on, we have integrated and identified motivation, which are highly regarded for long-term engagement in exercise due to their higher intrinsic value. Health professionals should encourage these types of motivation for that reason. Next up is the achievement goal theory, which introduces two goal orientations, which are dependent on an individual's competence in an achievement setting and results in different behavior, affective, and cognitive outcomes. The two goal orientations are mastery and performance. It is suggested that individuals that actively participate in physical activity reported higher perception of exercise competence and mastery orientation when compared to non exercisers. This may suggest that mastery orientation is best to strive for when individuals are looking to engage in long term physical activity. Interventions that can be implemented by health professionals may include counselling, such as the 5A's technique, brief motivational interviewing, education of exercise guidelines, and promotion of self improvement and competence of ability. Other interventions include referral to community based interventions or allied health professionals, and prescriptions for exercise. Interventions during include follow up appointments and encouragement of active social relationships. Overall, health professionals have many interventions available to motivate people to exercise. It is important for them to consider the patient's motivation type and goal orientation to assess which intervention is best. Patients should strive to be intrinsically motivated with a mastery orientation to achieve long term engagement with exercise. Thanks for coming to today's lesson. I'll see you next time.
Created using Powtoon.